This video is intended to demonstrate the duties of a non-sterile assistant in the operating room. In this video, we will cover how to prepare items for sterilization, how to open sterile items for surgery, and how to change a surgeon's gloves during surgery. We will begin with folding surgery towels. There are many methods to get the same result. I like to start with the seams facing down and fold the towel in half lengthwise. Then I fold each side towards the center. Finally, I will fold the towel in thirds. This makes it easy for the surgeon to drape in the patient with the seams facing down. Next, we move on to wrapping a surgery pack in cloth drapes. Always check the instrument list to make sure that all instruments are accounted for before wrapping the pack. Add in a 10 and 15 blade and 4 folded drape towels. Lastly, make sure to add a sterile indicator strip on top so that it's easily visible when the pack is opened. Start with the drapes laid out in a diamond arrangement, not square. Bring the bottom triangle towards the center, make sure it is snug against the pack. Leaving a tab to pull is recommended for ease of opening and maintaining sterility. Next, you'll fold in the sides in the same fashion. To finish, you'll bring down the top of the drape and tuck it underneath all 3 layers you've created. This keeps the pack nicely held together. I like to leave a tab here so that it's easy to pull out to open. For the second layer of cloth drape, we repeat the same process, making sure each fold is nice and tight. For the outside of the pack, we will add a small piece of autoclave indicator tape. Then we will use masking tape to keep the pack closed. On the masking tape, make sure to label it with the pack number or contents, your initials, and the date it was wrapped. Now the pack is ready for the autoclave. To use self-sealing packs, place the item in the open end along with a sterile indicator strip. Peel off the paper tab and fold it and stick it to the plastic. The item is now sealed. If the instrument has sharp points, they should face the plastic side of the package, not the paper side. As with anything else that gets sterilized, make sure to label it with the contents, your initials, and the date it was wrapped. This item is now ready for autoclave or gas sterilization. Next on our list is opening sterile items for surgery. Before opening the pack, confirm that the autoclave indicator tape has changed colors correctly and that you check for your initials and group number on the masking tape. In our surgery suite, a non-sterile assistant will open the first cloth drape and a sterile person will open the second. To do this, first rip off or peel the masking tape, then pull on each quarter of the wrap to open it, grabbing the outer side of the cloth. Do not touch the inside of the wrap if you are not sterile, and do not reach over the sterile pack. Instead, step to the side so your arms do not cross over the sterile surface. After the first layer is opened, a sterile person will open the second layer. While doing this, they ensure that they do not let their gown touch the parts of the wrap that have dropped below the table. Before anything from the pack is used, you must again check the indicator strip to confirm sterility. Once you've confirmed sterility, peel packs can be distributed in one of two ways. You can hand them off directly or drop them onto the sterile instrument table. In both cases, the peel pack is peeled from the top and opened without touching the inside of the pouch. Tearing or cutting the package will likely contaminate the contents. Likewise for gauze, peel off the paper seal and either drop it onto the instrument table or allow a surgeon to grab it from the package. Dropping drapes can be somewhat complicated because they are bulkier. Take your time to peel the edges back without touching the inside of the pouch. Laying it back against your arm while opening can help stabilize the drape before flipping it onto the instrument table. In this lab, we end up doing many glove changes between patients or if students contaminate a glove. For a surgeon wearing a single pair of gloves, the non-sterile assistant will grab the gown cuffs through the gloves and pull the cuff over the surgeon's hand while removing the glove. Here, we'll see a closer look at this process. Try not to pinch the surgeon's skin while grabbing the cuffs of the gown. Pulling gently, sometimes using a wiggling motion, will help avoid making a tear in the gown. Once the old gloves are off, the non-sterile assistant will hand them a pair of new gloves in the same manner that any other peel package is used. Anytime a surgeon dons new gloves, they should do so on a sterile surface. Otherwise, they risk contamination of their gown sleeves. A surgeon that is double gloved should remove the outer pair of gloves on their own, keeping the inner pair sterile. Just as before, they should wait for a non-sterile assistant to hand them off a new pair of gloves and use a sterile surface to don them.